There it goes. Good morning. We're going to give it just a couple more minutes just to make sure no one else is going to log on this morning. So just a couple minutes and we'll get started here. All right, good morning, everyone. I think we're going to get started here. My name is Elizabeth Wiens. I'm a newer nurse at Two Rivers Public Health Department. It's good to have you all here this morning. I'm going to go ahead and talk a little bit today about just our COVID status, a little bit about influenza, and then give a little bit of information about just some sun safety. So moving on to our first slide. There we go. So the Two Rivers Public Health Department serves almost 1,000 individuals in 7 counties that cover approximately 4,624 square miles. These counties include Buffalo County, Dawson, Phelps, Kearney, Harlan, Franklin, and Gosper. So you can see that we do a variety of things here, including disease surveillance, chronic disease prevention, emergency response. We have the Life Smiles Dental Program and many other things that we're involved in. Our mission at Two Rivers is that the Two Rivers Public Health Department engages in collaborative partners, community leaders, and the public to promote healthy lifestyles, provide preventive education, assure environmental quality, and create more healthy and safe communities for all who live within the district. Our vision is for Two Rivers is that the Two Rivers Public Health Department envisions a health district where all are able to safely and actively live, learn, work, and play in their communities. Two Rivers Public Health Department facilitates collaborative partnerships and unique approaches that educate, empower, and engage local community partners, health providers, political decision makers, community leadership, and the public. So our goal is just that to help provide that information and support to make our community healthier. This is a slide that has our Two Rivers Public Health Department nursing team. Our newest addition is Jordan Anderson. She just joined us a few weeks ago. And we still have Susan Puckett up here. She did retire on Friday. We will really miss her, but just wanted everyone to know that she has officially retired and that if you need anything from any of us, please feel free to contact any of us at any time. As you can see, this divides the United States up into the districts, and we are district number 7. So this next slide focuses on just the data for COVID numbers throughout the United States, as well as our District 7. So total US confirmed COVID-19 cases is 85,344,502. Over the entire United States, the 7-day average per 100,000 people is 228.9 cases. And total US deaths are 1,606,450. Now, when we look at region 7, we've had 3,551,001 cases and 43,710 total deaths. So the map just shows over here where Nebraska lies, given our numbers per 100,000 people, and we have 167.5 cases per 100,000 people, which is below the national average, which is a good thing. We like to see that. Then if we look at the states within our district, Nebraska, you can see we have total confirmed as of yesterday of 491,350 COVID diagnoses, and then 4,323 deaths. And then if you look at the rest, like Kansas, Missouri, and Iowa, we continue to do well in comparison in terms of our numbers. So that just kind of gives you an update on where we're at as of yesterday with those numbers. So looking at this dashboard, you can see we are still in the green zone for our the risk dial. There's a few other things we would like to point out on this dashboard. On the top left, you can see that the 7-day rolling average in cases during 2022, which is the orange line, is still higher than in 2021, which is the blue line. During the week of June 3rd through June 9th, about 21 cases reported to Two Rivers Public Health Department every day. Then if you look at the bottom left, you can see that the number of positive cases reported in red increased for several weeks in a row and then decreased. When we look at the bottom right, you notice that the majority of the cases are reported in working age people and in people who are over 80. We do plan on releasing a public-facing risk dial this week, but the previous risk dial shows that we were still in the green low level of risk. This is our Two Rivers Public Health Department hospital data, and here are the quick takeaways on this information. When we look at the percent of beds occupied by COVID-19 patients on the top right, we can see a steady increase during the month of May and into June. The graph of COVID hospitalized shown in green and yellow on the bottom right, the fluctuations in the graph tend to follow the trends in cases in the district. This graph also shows our recent increases in cases. The last notable information on this dashboard shows that ICU availability has fluctuated quite a bit since May, shown on the top left. It is important to note that only about 30% of Two Rivers Public Health Department's ICU beds were available on the 13th. So still talking about COVID, you probably noticed that as of May 19th, the CDC recommended that children ages 5 to 11 receive a COVID booster 5 months after completing their Pfizer vaccination series. So now anyone 5 or over in the US can receive a COVID booster. The 5 to 11-year-old vaccination rate, which is 35.9%, continues to lag behind other age groups, which puts these children at increased risk for serious illness. As a comparison, the 12 to 17-year-old vaccination rate is 69.5%. And since the pandemic began, more than 4.8 million children ages 5 to 11 years old have been diagnosed with COVID-19. 15,000 have been hospitalized, and almost 200 have died. So it is continues to be a major concern, and it's important that we encourage this families and parents of this age group to, educate themselves and making those decisions for their children about vaccination. The CDC gives some good information of 6 things to know about COVID-19 vaccination for children. The first one is that COVID-19 vaccination is safe for children, and they just ensure parents that scientists conducted clinical trials prior to recommending the COVID-19 vaccination for children. And then the US Food and Drug Administration determined that Pfizer COVID-19 vaccine is safe and effective and authorized it for emergency use in children. Its use continues to be monitored for safety. And that continues, it's been showing that COVID-19 vaccination continues to be safe for children, and that the benefits of COVID-19 vaccination outweigh the known potential risks. Also, getting vaccinated can help protect children against COVID-19. Obviously, it gives children less of a risk of getting seriously sick if they do get COVID-19. And then it helps children stay safe when they're in larger groups, such as daycare settings, schools, sporting events, play dates, and any type of extracurricular activities that many children participate in. Number 3, children may have some side effects after COVID-19 vaccination. The good news is that reported side effects are like those experienced after routine vaccines, and side effects may affect your child's ability to do daily activities, but they should go away within a few days. And research has shown that side effects are more common after the second shot, and that some children even have no side effects whatsoever. Number 4, different dosage of the COVID-19 vaccine is given to children. So children receive a smaller dose of the COVID-19 vaccine that can be reassuring to parents when trying to educate them about the COVID-19 vaccination. It does have the same active ingredients as the Pfizer COVID-19 vaccine that's given to people ages 12 and older. However, the vaccine for teens and adults cannot be given to children ages 5 through 11 years. They've got that smaller dose. Children who have already had COVID-19 should still be vaccinated. It's just emerging evidence indicates that people can get added protection by getting vaccinated after they have been infected with the virus that causes COVID-19. And then finally, children can safely receive other vaccines at the same day they receive their COVID-19 vaccine. It's important to stay on track with your preventative vaccines, and there's no reason why you couldn't receive all of them at the same time. It says multiple vaccines are given at a single visit Each injection will be given in a different injection site according to the recommendations by age. So sometimes some of this information can be helpful when, chatting with parents or caregivers about whether or not to vaccinate their younger children for COVID-19. This is as the CDC continues to update their recommendations for frequency of vaccination, sometimes it's difficult to determine when and how often one should receive a vaccine dose. So this vaccination schedule, which the CDC just put out, can help medical professionals navigate the number and intervals of COVID-19 vaccine doses, and both the immunocompromised and the average person. It just kind of lays it out pretty easy to read. So as a practitioner, even as a layperson, you can kind of see where you could be at in terms of your vaccination status. Moving on to influenza, seasonal influenza viruses continue to circulate and activity is increasing in parts of the country. You can see that on this map here to the bottom right. Some of the hotspots include Nevada, New Mexico, and Florida. So it still, it still does continue to circulate, and in terms of the influenza diagnoses over the last year, there's been 7.8 million flu illnesses, 80,000 hospitalizations, and 4,900 deaths from flu. So something just to still keep on the radar for sure. As the weather has obviously been warmer here over the last week for sure, it is important to be aware of some of the risks that can come with being out in the sun for too long. With the weather being nicer, that tends to attract us to being outside, which is a good thing. We want to be active, but we also need to be aware that it puts us at risk for things such as skin cancer and dehydration. So skin cancer is the most common cancer in the United States. 1 in 5 Americans will develop skin cancer by the age of 70. If you break that down by our population, that's about 66 million people, which is an immense amount of people that could be diagnosed. More than 2 people die of skin cancer in the US every hour. Having 5 or more sunburns doubles your risk for melanoma. The good news is that when detected early, the 5-year survival rate for melanoma is 99%. So that's what's pretty awesome. So just being aware and checking our skin and then doing what we can to eliminate our risk for sunburn and skin cancer is a top priority. So this next slide kind of discusses the safe ways that you can still be outdoors, but reduce your risk of sun damage and skin cancer. So the first option obviously would be to stay in the shade. By staying in the shade, you reduce your risk of skin damage and sun damage and skin cancer. And in doing so, you could stay under an umbrella, a tree, or any other shelter. Your best bet to protect your skin is to use sunscreen or wear protective clothing when you're outside, even when you're in the shade. So in terms of clothing, when possible, wear long sleeve shirts and long pants and skirts, which can provide protection from UV rays. If wearing this type of clothing isn't practical, try to wear a t-shirt or a beach cover-up. Clothes made from tightly woven fabric offer the best protection. A wet t-shirt offers much less UV protection than a dry one, and darker colors may offer more protection than lighter colors. Some clothing is certified under international standards as offering UV protection, so that's something to look for. Wearing a hat can be very helpful. For the most protection, wear a hat that has a brim all the way around the shape, and that shades your face, ears, and the back of your neck. A tightly woven fabric such as canvas works best to protect your skin from UV rays. Avoid straw hats with holes that let sunlight through. A darker hat may offer more UV protection. If you wear a baseball cap, you should also protect your ears and the back of your neck by wearing clothing that covers those areas, using sunscreen or staying in the shade. Sunglasses are another great way to add protection to your eyes from UV rays and reduce the risk of cataracts. They also protect the tender skin around your eyes from sun exposure. Sunglasses that block both UVA and UVB rays offer the most and best protection. Most sunglasses sold in the United States, regardless of cost, meet this standard. Wraparound sunglasses work best because they block UV rays from sneaking in from the side. So sunscreen is a very important way to prevent your skin damage and skin cancer. Putting on a broad spectrum sunscreen that blocks both UVA and UVB rays and has an SPF of 15 or higher before you go outside is very important. Don't forget to put a thick layer on all exposed skin. If you have trouble, it's important to cover all areas that are open to the sun, so get help to get to those hard to reach places like your back. Don't be afraid to apply sunscreen liberally, like a minimum of 1 ounce at least 20 minutes before sun exposure. Apply sunscreen to all exposed skin and remember to apply to ears, scalp, lips, neck, top of feet, and back of hands. Reapply at least every 2 hours and each time you get out of the water or sweat heavily. If you're also using insect repellent, apply sunscreen first and repellent second. Sunscreen may need to be reapplied more often. Sunscreens are only good for 1 to 2 years, so whatever's left after that, please throw that away and move to a new bottle. Sunscreen active ingredients can be divided into 2 categories, and these include chemical and mineral. There are some people that are sensitive to one or the other, so it's good that there's an option for these people. Chemical sunscreens absorb the sun's UV rays. And sorry, I skipped to the wrong slide. Sorry about that, guys. Wasn't quite done talking about that. Give me just a moment here. Okay. And mineral barrier sunscreens reflect UV rays away from your body. So both types of sunscreen are effective at protecting skin from sun damage. Sunscreen is not recommended for babies who are 6 months old or younger. The U.S. Food and Drug Administration recommends keeping infants out of the sun during midday and using protective clothing if they have to be in the sun. So any combination of these options, sunscreen, sunglasses, hat, protective clothing, staying in the shade, those are all important and good, and all together, working together is very effective for protecting ourselves from that sun and skin damage. So now we'll move back over to this slide. As you can see on this infographic, there are many benefits of staying hydrated. An important question is, how much water do you need every day? Every day you lose water through your breath, perspiration, urine, and bowel movements. For your body to function properly, you must replenish its water supply by consuming beverages and foods that contain water. So the important question is, how much fluid does the average healthy adult living in a temperate climate need? According to the U.S. National Academies of Sciences, Engineering, and Medicine, they have found that an adequate daily fluid intake for a man is about 15.5 cups. And for a woman, about 11.5 cups. Now, this is obviously this is just for an average day. So if you're working outdoors or doing something where you're sweating heavily, you're gonna need more water than that for sure. All right, so just a couple of final slides here. We do continue to offer COVID-19 testing at our office from 9:30 to 10:30 Mondays and Wednesdays. It's important that those who want to be tested register on our website, trphd.org. And then we continue to offer about weekly in-house vaccination clinics. We'll be at the Buffalo County Fairgrounds tonight from 5 to 7. And then in Holdridge tomorrow at the City Auditorium from 4 to 6. And then you can see where the other vaccination days and that we are offering those in our office. Well, that concludes my presentation. Please feel free to ask any questions at this time. I appreciate you guys all listening and being here this morning. Thank you.
Hey Liz, I don't see any questions. It looks like you did a great job. Thank you.
Thank you.